then having an accident, and then they would bring them because we were the closest hospital. Or the chief of the hamlet that was sick, and they'd bring him in through the back door, and he would wheel and deal so we wouldn't send him back to a Vietnamese hospital because everybody knew that our medicine was good, very good, and our supplies were modern. And we would get all kinds of patients. Like I said, we got GIs, Vietnamese and POWs, we got children, we got grandmas, we got pregnant women that some GI out in the field would run into a pregnant woman. He'd panic, put her on a chopper, and have her come to the hospital to have her baby because he didn't know what to do, you know, things like that. And that was kind of nice. That was really nice to have that happen, to see life for a change. But it was also sad because I felt bad that a child would be brought into a world of war. So there were mixed feelings about having those kind of patients. And sometimes it was quiet where nothing was going on, nothing, absolutely nothing. We would be bored to tears. And during the quiet times, we would be allowed to take a couple of hours off, go back to the hooch, take a nap, write letters, go swimming. There was a unit nearby that was an engineer, and they dug up this big giant hole and put a temporary tarp, real big, huge tarp that they use to land aircraft. The black would rub off on your skin and your bathing suit, but it was something to get cool in, so we would go there. Or we would go to the PX, because they had lots of tapes. I was into music, I'm into rock, and they always, you know, you would hear through the grapevine that there would be a huge supply coming in if you knew the right people, and you would go and pick up the tapes or wheel and deal with somebody to trade tapes with you or what have you. So that was kind of the typical day. I was at the 12th evac the whole year that I was in Vietnam. It was the most busiest hospital in Vietnam at that time. In fact, we got a unit citation for our work. And in the beginning, I had heard somewhere that you didn't have to spend the whole 6 months there because it was such a busy hospital, that they try to rotate the nurses so they're in a busy hospital for 6 months, and they can transfer to a quieter hospital for the last 6 months, or vice versa. And it never occurred to me to remind my superiors that it was time for me to leave. And actually, I think I liked where I was, and I wanted to stay where I was. As much as I hated what I was doing, I didn't really want to go to a quieter place because I felt I was really doing something. Remember, I was anti-war. I really feel that we have the intelligence and the ability to avoid war, that we can negotiate. But I also know that big business makes a lot of money. Everything from the people that make the uniforms to the people that pave the roads to the people that make the, or I shouldn't say people, the organizations that make war weapons. But I didn't believe in war when I went there, and when I was there, I definitely didn't believe in the war. For me, it was a big waste. And when I came back from Vietnam, I still remained anti-war, and I still, to this day. We didn't just take care of the GIs, U.S. GIs in Vietnam. We took care of our own men. We took care of the ARVNs, which was the South Vietnamese Army, and we also took care of civilians. If civilians were injured severely, we would take them in, try to patch them up, and then send them off to the civilian hospitals, or we would keep them. It just kind of depended on how bad they were. For instance, I got a young Vietnamese woman who set herself on fire because her GI boyfriend decided to go home without her. He had told her he would marry her and take her home with him, and at the last minute let her know she wasn't coming with him. We had two Vietnamese little boys, two brothers that had severe burns because they were hit with phosphorus grenades. And I had never seen the type of complications that come from phosphorus burns. Actually, I had never seen phosphorus burns before, so that in itself was horrible. A phosphorus burn will hit you on your skin, and it'll go all the way through your body. In other words, it goes through your muscle, through the bone, and out the other side. And our job was to neutralize the burns and to keep them wet and full of the chemicals that we had. But with the kids, the area of the burns were so bad that they ended up, dying. And then I took care of guys that were burned from fire, fuel. You know, what they used to do was burn, I'm going to say that, feces, and they would put kerosene on it and burn it, and sometimes guys would have accidents where it'd be burnt all over their chest. So it was my job to keep them clean and put sulfamylon, which was this cream, over them, and then clean them another 12 hours later. And we didn't have the kind of drugs or whirlpool that would have made that whole process easier. So, of course, there was a lot of screaming and a lot of pain. And that was one area of nursing I hated, because I always wanted to give comfort. I didn't want to create pain. And if you moved the wrong way, sometimes you'd poke them and they'd scream because it would hurt, and you'd spend the whole time apologizing because every move you made would hurt. And then the other side were amputations with complications, and those were usually legs were cut off, and belly wounds and chest wounds. That regular, simple amputation wasn't considered severe unless he started getting a lot of infections. And we'd find maggots in the tissues, and which, I don't know, it's supposed to be good because they clean the tissues, but at the same time, who wants bugs, you know, on your body? And we also took care of POWs. We got a few North Vietnamese that we had to take care of as well. I had dealt with older men dying from heart attacks. I had dealt with people who died from cancer. I had even dealt with teenagers that were dying from leukemia. But it was so different. You know, the cancer is God-made, and the injuries I was seeing from these men from war was man-made, and it was different, and it was very hard for me to accept. And the common theme among a lot of these men were, what's going to happen to my mother when she gets the telegram that I've died? And I wasn't prepared for that. I didn't know what to say. But it was so important for them to get some kind of comfort that their moms would be okay after they went. They were more concerned about their mothers than themselves. Although most of our lives we were told that women were inferior to men, by the time we hit Vietnam, we realized that we were very strong emotionally and that we could deal with almost anything. The triage system was used, I believe, by the French. The whole idea was to prioritize who to work on and how soon. When you had walking wounded in with shrapnel wounds, like on the arms and legs and areas that it wasn't essential to work on them right away, we would just put them on a ward to wait until the operating rooms were free. For the other guys that were seriously wounded that we could work on for an hour or two and save their lives, we hustled them to the OR. Or we put them in a pre-op situation, a pre-op unit, where it was like an ICU, where we kept an eye on everybody, took their blood pressure, talked to them, and if we felt anybody was starting to fall, we would run into OR and say, hurry up, we got somebody we need to rush in right away. But then there were the guys that were just so severely wounded there'd be no way of saving them. And people ask, well, was that a hard decision to make? But you become very technical. If you see that 5 men are going to live, if you keep 1 man out of the OR, you're going to, of course, choose those 5 men and not allow that 1 man to go in OR. But it's not to say that if it's quiet, and this is during a mass cal when we're getting 5 severely injured men in every 5 minutes or every 15 minutes. You know, it's a big battle out there, and they keep on coming in from 10 to 18 hours a day. But there are times when we didn't have mass cals, or it wasn't that bad. So if we did get somebody in and there was an OR open and we didn't expect more severe casualties, we worked on him until he died. And I think those were the more emotional times, because we had spent so much time and energy, and you'd watch the heart monitor, and then it would start beeping, and then all of a sudden it would go flat. And you had time to think about it after that. You had time to grieve a little bit among your staff. During mass cal, there was no time to grieve. I would deal with somebody, he'd talk about his mother, he'd die, and then I have to go on to the next guy and save his life. It's not an emotional decision. Triage is a technical decision. And what we did with our emotions, we just put it away. We didn't have any emotions. We just put the walls up.